Hello and welcome to this webinar on the relationship between physical exercise and psychological well-being, with particular reference to veteran and military populations. Very warm welcome to all of you who've joined us today for the live activity, and judging by the numbers of people who've signed up, this is clearly an area that's of great interest to many of you. Welcome also to those of you who are watching us later on a video, and a very warm welcome to our panellists who I will introduce to you in just a minute. First, I'd like to acknowledge the traditional custodians of the lands across Australia upon which our panellists and our participants are located. I'd like to pay our respects to their elders, past, present and future. And in the context of this series, I'd like to particularly acknowledge the many Indigenous men and women who've served in the Australian Defence Force over the years. I think we'd all agree that exercise is good for our physical fitness and for our physical health. But I think for a long time, we assumed that physical health and mental health were completely separate. In recent years, we're increasingly understanding that the two are inextricably linked together. And this is particularly true when we think about the role of exercise on psychological health and well-being. So the aim of this webinar is to provide you with an understanding of that relationship, an understanding of how physical exercise can promote good mental health. And I really hope that at the end of this webinar, we'll all go away resolved to increase the role of physical activity in our day-to-day lives. My name's Mark Creamer. I'm a clinical psychologist in private practice and also a professor in the Department of Psychiatry at the University of Melbourne. And I've had a very long interest in the mental health effects of trauma, and particularly in veteran and military mental health. And as a clinician working with veterans and serving personnel, I am a real believer in the role of exercise as part of a broad treatment plan. And so I'm thrilled to be able to facilitate this panel discussion and to draw on the expertise of our two panel members today. So without further ado, let me introduce them. You've already got copies of their bios, and so I won't go into great detail. But first, let me introduce Adrian Talbot. Adrian joined the Royal Marines Commandos in the UK back in 2005. He was deployed to Afghanistan. He later trained with the military police and became an investigator before being injured in 2009. He went through extensive surgery and rehabilitation, which he'll tell you all about, before eventually discharging. And he's currently the executive manager of the Homes for Heroes program. Adrian competed in the 2014 Invictus Games in London and came back with not one, but 2 gold medals, which you have to agree is pretty impressive. He's also an ambassador for the 2018 Games in Sydney. Welcome, Adrian. Thank you very much for joining us today.
Thank you, Mark. Thanks for having me.
I suspect everybody knows, but just to make sure we're on the same page, can you just give us a 1 or 2 sentence idea of what the Invictus Games are?
Essentially, it's reconnecting with that military family that some people lose when they go through that discharge process. So it's games for the wounded, injured and ill where they can rejoin the family.
Yeah. And I note that I've got a feeling that they were actually created by, but certainly they're very actively supported by Prince Harry. How important is it, do you think, that you have such a high-profile patron in an initiative like this?
Mark, I think it's part of what makes the games so inspirational to everybody that see them. I mean, he's a true ambassador for pretty much all walks of life. You know, we were having a discussion about this just before. He's been there, he's done it, he's served, and now he's continuing to serve and assist people on their recovery journeys. Right. He's phenomenal. Yeah. Mm.
Yeah. Okay, good. We might come back and talk about him a bit more in a minute. Thank you very much, Adrian.
Thanks.
Dr. Sam Hay was a senior medical officer in the Army, and he started his military career in the parachute surgical team, which was a small elite team that was designed to respond to medical emergencies anywhere, anytime. He deployed to Afghanistan, where he worked alongside an American helicopter-based retrieval team. He's now a general practitioner in Sydney and makes regular media appearances on TV and radio, including hosting shows such as Amazing Medical Stories and embarrassing bodies down under. I think there's got to be a joke there somewhere, but I'm going to leave it. So welcome, Sam, and thank you very much for joining us today.
Cheers, mate. Cheers.
I understand that exercise and physical fitness is a bit of a passion for you. Is that right?
Definitely, it's part of my life. It always has been since I was growing up. I grew up in a rowing family, and so I've certainly been very active myself, and it keeps me sane. And it was something that I got a lot out of with the military career as well.
But I also notice that you're a bit passionate about beer, which is certainly something that I can relate to. But is there not a bit of a conflict there, do you think?
Look, it all depends on how much you drink, I think, Mark. Certainly, look, I do enjoy beer, and certainly drinking beer and alcohol in moderation can be part of a healthy lifestyle. Just can't take it too far.
And if you're going to drink, you might as well drink good stuff, I suppose.
Oh, definitely, without a doubt.
OK, thank you very much, Sam. Thank you, Adrian. Before we get started, I just need to do a little bit of tech administration stuff. If you have any technical difficulties, please ring the number that's on your screen there. That's 1-888-733-416. In terms of actually, I should say that on my notes here, I've got 1-800-733-416, so it's one of the two. The webinar is going to go for about an hour, and the first half will be presentations from our two panellists. The second half will be a question and answer, general discussion kind of format. So many of you have already sent in questions, and thank you very much for those. We've had some great questions coming in. But I would remind you that you can also submit questions or make comments anytime through the course of the webinar, and they'll come up in front of me on a little screen. And I'll be able to read them there. We may not be able to answer all the questions that we receive because of time constraints, but we'll certainly do our very best. The webinar is being recorded and will be made available in about a week. We'll advertise it through various kind of websites, the VVCS website, and VVCS will advertise it through their Facebook and Twitter feeds, and please feel free to forward those to your colleagues. Finally, we will be asking you at the end to complete a feedback survey. It's really important for us to get some feeling for making sure this stuff is relevant to you. So please make sure you do that. But now, without further ado, I would like to ask the first of our panellists, Adrian Talbot, to tell us a little bit about his background, his personal experiences, and in particular, the role of exercise in his life and in promoting his mental health. So it's over to you, Adrian.
Thanks, Mark. Ladies and gentlemen, boys and girls, I promised, it was actually a couple of months ago, that this is the last time I was going to share my story, and then this opportunity came up to share it again. But I think it's particularly pertinent now because we've got the Invictus Games that are coming to my hometown in 2018, and so I want to share with you that the power and the healing power of sport that's featured in my life and in the lives of my family. So without further ado, I'll share with you the journey. It's the reason I don't like talking about it is because I'm in a different place now. My journey of recovery is somewhat over. However, I do have to have more surgery before the end of the year, which is kind of taking me back to the start of that journey. But I've got all that lived experience from the journey so far. So in 2006, I flew back into the country with my fellow Royal Marine Commandos from an operational deployment in Afghanistan. It was about 3 a.m, cold and wet, much like 95% of the weather in Britain. We travelled under the cover of darkness back to our commando unit in Plymouth. A week later, I was back with my fiancée, now wife of 11 years, but I was different.
Don't forget your slides.
Yeah, thank you. While at home, my wife contended with sleepless nights, and when sleep finally came, it was disturbed by my dreams. Some nights she would be woken by my dreams and me clambering for my rifle, which was obviously not there. Yes, ladies and gentlemen, I had PTSD. We were married shortly after my deployment and expecting our first beautiful girl, Eliza. I was given some downtime in the recruiting office so I could spend time with my wife and my family and my new baby girl. The sad reality was that I found it hard to enjoy anything. I was physically present for the birth of Eliza, but emotionally detached. I could still remember what happiness felt like, but I didn't feel anything. so I pretended for many years. Friends were killed in Afghanistan. I dealt with this by not dealing with it. One of the lads who died, I went through training with him. I arrived back in country after some leave that I'd been given, and it was the first day in a new job as the Royal Marines as a police investigator down in Plymouth. I introduced myself to my sergeant, and he informed me my first job was to go downstairs and check through the will of one of the lads that had unfortunately been blown up in Afghanistan. My mate Topsy, who you just saw on that slide, he was on the left. He was down there, and he was already going through the boxes. We call them repack boxes. I looked down at the boxes and immediately recognised the name and the service number on the side of the box. I told Topsy I knew him, and he said, "Look, mate, go and get a coffee," as a mate would do. But I left the room because I knew it was what I should do, but I had no feeling. Many years I repressed my emotions and cracked on with the job. The birth of my second daughter, Sophie, no emotion. In 2009, I was diagnosed with osteoarthritis in my hips. Initially, I was retained within the unit, and then continued working. And it wasn't until it was deemed unsafe for me to continue, they sent me home. I was highly medicated, with limited mobility, and I was waiting for my surgery. After the first procedure, where they went in and had to surgically break my femur. Yeah, thank you. Yeah, so that's a more recent surgery, and it looks like I perhaps I've been operated on by Frankenstein's family, perhaps. But that was a full right hip replacement. That was my sort of 9th surgical procedure at the time. And my beautiful girls, Eliza's not in that picture, but and that blanket I actually got when I was in Hasler Company in the Royal Marines, which was donated by some lovely ladies over there that used to knit them and give them into Hasler. So many months later, I was sent into full-time rehabilitation at Hasler, and there was a lot of young guys and girls. So there was wounded, injured and ill people that were being sent from all around the country to be in this facility that could cater for their needs. There was a lot of guys obviously returning from Afghanistan with significant battle injuries. This was quite a humbling experience for me because before I'd gone to Hasler, I was feeling quite sorry for myself in the way that, I'd had my loss of career and I wanted to continue serving, but I couldn't because of my injuries. So I turn up first day at Hasler, and we're in 3 ranks with all the guys and girls that had been sent there. And I recognised the guy immediately, who was a bloke that I'd gone through training with. And he'd gone over to Afghan shortly after he'd finished training, because when we were in training together, he'd gone home, and the troop Stripey had sent me to go and see this young lad, because he was a good lad, he was strong and determined, and they didn't want to lose him. But so the troop Stripey said, Oz, go and have a chat to him and see if you can keep him in the unit. And he wouldn't go, because once he'd decided, like all of us, once you're set on that path, it's very hard to change it. And so he went home, he went back up north, and I said to him at the time, because I'd actually left training and come back, mate, once this is sort of in you, it's going to be hard for you to let it go. And he goes, no, I'm going back to my family, I'm going to work with my dad, roofing, I think it was. Anyways, unbeknownst to me, this guy comes back, rejoins, finishes commando training, and then goes out to Afghanistan. And they've been patrolling through a small village for a couple of weeks, and they'd built up rapport with the locals. And the farmer who they'd built rapport with, his son was walking with a wheelbarrow. So they stopped the patrol, they all went to ground, and the young boy, unbeknownst to them, had it was laden with plastic explosives, and he got to the tail end Charlie and detonated. And so my mate he had the ECM equipment on, and that actually saved his life. The guy at the rear of the patrol, unfortunately didn't survive it. And my friend, he lived, but he had significant injury. So, I turn up at Hasler Company and he walks up to me after we'd done the roll call and goes, "Oh, it's because of you I've been blown up." And, it's a terrible thing to say, but, that sort of banter and morale in the military, I had a little chuckle and said, well, I did tell you should have just stayed in training with me, and then you would have been safe. And but yeah, to this day, he's used the power of sport through his healing. But yeah, good lad. So I was reunited with old mates, and in Hasler, sport featured quite a lot. Every morning we'd do, you'd have 4 hours of physical activity. So it then became part of my recovery journey. So people who are injured, wounded and ill and focused their attention on a new future like me. So in 2012, I was medically discharged from service. I lost my military family. We moved back to Australia to be with my folks as the future was uncharted. I became involved in assisting other veterans on their roads of recovery here in Australia. In 2013, I walked Kokoda with the family of the fallen from Australians that paid the ultimate sacrifice in Afghanistan. I came home from that trip realising I was unwell and needed some help. Then Prince Harry unveiled London Invictus Games in 2014. Sport had been a part of my life since I left the military. It provided me with a social outlet outside of defence. It also provided my wife with some respite from me. My expectations of Invictus in 2014 were met and then surpassed. Invictus is for families who are going or have gone through adversity to reconnect with others who are also going through similar journeys. Invictus provides our unsung heroes with a stage to showcase what they have and can achieve in life. For many, they would have been told what they can't do. You won't be able to run or compete. You won't be able to do a lot of things. This is untrue. You can. Just quickly, there's some pictures of my Invictus journey. So just on that, the one on the left there is a good friend of mine, or good friends of mine. We're just about to go on to the closing ceremony. It's kind of one of my favourite pictures because you can just see how happy we are at the end of the games. It's truly phenomenal. And Prince Harry, he came to the embassy. We obviously didn't know that he was going to be joining us. And next thing you know, Prince Harry comes in and comes around and introduces himself individually to everyone to sort of start building rapport with the Australian athletes. And then the picture of Harry and my beautiful wife, Emily, and baby Jean came with us on that trip. So I was competing in the swimming, and my wife didn't actually know that I could swim, which was quite amusing. And Prince Harry's one of his good mates, he was the team captain that year, David Wiseman. So he snuck in the side entrance and sat down next to Emily. And Emily had gone to see her family during the week, and she hadn't got to meet Harry, so she was absolutely gutted. So she said to, "Oh, look, I'm not going to get to meet Harry. I've come all this way, and all I want to do is meet Harry." So he walks in and sits down next to her, and so Em immediately hands our child to Prince Harry, and he goes, "No, I can't hold children anymore. I almost dropped one the other day." And so she got the photo, and but Jean, as you can see there, every time they took a photo, she was doing something, and in that one she was obviously yawning. So yeah, the Invictus Games, purely phenomenal, and they helped me on my journey of recovery.
Wonderful. Thank you very much, Adrian. It's an amazing story, and we could probably sit and listen to that for most of the day, I think, because it's an extraordinary story. And we will pick up on a number of the points that you raised, I think, as we get into our discussion. It did just strike me, though, in your experience in the Invictus Games, I'm wondering, I guess a lot of people will use injury as a excuse, if you like, for not exercising. You presumably competed with some pretty disabled people, or in the Games anyway, wouldn't you?
Oh, yeah, most certainly, Mark. You have people from, they have different categories within the Invictus Games. And I can't recall off the top of my head what the categories are called, but obviously you have people that have had catastrophic, battle injuries. You've got other people that went through illnesses in defence, and then those unseen injuries, your psychological injuries, which, in order for them, for a lot of those people to even get out of bed in the morning and come to a huge stadium and compete, it's quite phenomenal that they feel supported in that environment. Because I know,
But I guess what it means is that, and we're not suggesting for a second that everybody's going to be an elite athlete or compete in the Invictus Games, but it does mean that just because you've got an injury, whether it's physical injury or psychological injury, doesn't mean that you can't get the benefits of exercise. So thanks very much, Adrian.
Thanks, Mike.
Our next speaker is Sam Hay, and he's going to give us a GP perspective on the topic and perhaps a word or two about his own military background. Sam.
Thanks, Mark. Yeah, good afternoon. I think we're up to everybody. My name's Sam Hay. I'm a general practitioner. I work in Sydney. My career did start in the Army. I did 5 years full-time and then continued on with a lot of reserve work. I posted up to Sydney. No, they're friends and family. Right, Here I am. I first posted into Sydney where I did some time at 1HSB with the parachute surgical team, then was the RMO at 3RAR, then back to 1HSB, and then several years at 1st Commando as the reserve RMO. I was fortunate enough to get a handful of deployments, and I think my highlight was definitely Afghanistan in 2006, where I did do some AME work and also worked in the trauma hospital in Kandahar. And Adrian and I realised that we must have crossed paths at some stage in Kandahar. Now my life is being a dad of 3. I've got 3 fantastic kids. I'm a GP, a business owner, and certainly do a handful of bits and pieces in the media. And there's no doubt that my military career is what set me up to do that. And I enjoy, I guess, being a doctor and being able to educate people, and media is one way that I can do that. I did want to talk, I guess, a little bit more about the evidence and the background around exercise and its effect on mental health. Yeah, the bottom line is exercise is definitely good for you. We all do know that. I think if you're educated in Australia, we know that exercise, it improves our general health. It helps with weight control, and it does reduce a number of other illnesses. When we look at exercise and what it's proven to do, it's proven to improve your cognition. It reduces depression. It improves stress. It reduces anxiety symptoms. It improves sleep. And even memory as well. It pumps more body around the brain, and they've even found that it increases the parts of your brain that are associated with memory. And we get increased connections between the cells in the brain. So exercise, it has other effects for you. Most interestingly, it's probably the more strenuous the exercise you do, that's linked to a greater improvement in the measures of both physical and mental quality of life. So not only do we want people getting out there and doing some exercise, but the more strenuous work you can do, better effects. As we said, the health benefits do go beyond psychological. There's the effects on obesity, heart disease, reducing cancer, and the list goes on. But obviously today we are looking at a bit more of the mental health effects that are there. Just jump back to this one. So when we're looking at this slide, I should say, when we're looking at a treatment of exercise for mild depression or stress or anxiety, exercise itself is an effective treatment on its own. It's usually thrown in as an adjunct, so people might be seeing a psychologist or using medications, and exercise is added in. But if you look at the evidence that's out there, for that mild level of distress, exercise can be a very effective treatment. I actually had a patient once. He was an elite rower. He was, borderline Australian representative, and he found that if he didn't train for 3 days, he would get very melancholic. He was literally housebound, and that was how depressed he could be. But when he was training the 2 to 3 times a day, probably 4 hours a day, his mood was very normal. He didn't need a psychologist. He didn't want to see a psychologist. He didn't need medication. So exercise alone for him was very effective. And I think that shows the power of what exercise can have. How does it work? You know, we could go into detail, we could talk for hours, but there are studies that show that it increases endorphins, it acts on the dopamine and the serotonin pathways in the brain, which are the main hormones that are associated with mood, especially depression, stress and anxiety. When we look at the trials that are out there, the effects of exercise they do vary, but it's all positive. Sometimes the effects are only small for some people, and like that rower chap I spoke about, the effects can be very large. And that is when we compare it to no treatment at all, or in conjunction with psychology and medications. And what we do see is that exercise it's very well adhered to. People that find exercise works will stick to it and keep going with it. There's even been some interesting studies through social media, and I found this one amazing. So they actually looked at people that do a lot of posts on social media about how much they exercise. They were also found to have a dramatically reduced number of social media posts that related to how angry or stressed or frustrated or depressed they were. So get out there and exercise, and maybe you can use this social media as well. Look, unfortunately, another area that our veterans and, of course, the families that are supporting them struggle with is PTSD. Now, what I found very interesting is that people with PTSD are renowned to be poor exercisers. As a group, they don't go out and do a lot of exercise, and the exercise they do is not very effective. But once again, the evidence that's out there shows that exercise does reduce the overall burden of PTSD. Symptoms are reduced. Effects are a bit greater for men than they are for women, but that may also be the population that they're studying. One study I looked at showed that there was a greater reduction in the hyperarousal symptoms, the avoidance and the numbness, especially in those that also had poor sleep. So exercise was effective at relieving those symptoms. A second study I found showed that exercise was very effective in reducing the symptoms of PTSD and anxiety sensitivity. But interestingly, those that were more unfit at the beginning had greater benefits from the exercise. And Adrian, you've probably seen that with some of your mates out there as well. Yeah. So I think that shows that we don't want to get to that unfit level to start with. People that are struggling with their PTSD, get out there and get active right from the beginning. The other thing that this study showed that the exercise should be sustained, that when people stopped exercising, the benefits really dropped off. A third study I found looked at people that were in a hospital setting, and they looked at two groups. One group had their usual care, their medication, psychology support, and then the other group had the same usual care but added exercise. And over the course of their inpatient treatment, they had a dramatically reduced level of PTSD symptoms, their weight went down, their waist went down, and their overall health improved. So from depression and PTSD, exercise is proven to be of benefit. It's proven to be a treatment, but probably used in conjunction with the other therapies that the members are using. So what can we actually do? What should we be doing? The thing I want people to be thinking about is getting out and exercising as a family. Certainly our veterans, we want you individually to be exercising, but it's something that can perhaps be targeted from a family perspective. So if you're a wife or a husband and you're trying to support a veteran that's struggling, getting everybody out there and exercising is what I want you to be thinking about. It creates a positive role model to the family. It creates good habits. Childhood obesity is increasing. They reckon that 1 in 4 kids are obese in Australia, and those rates are climbing. So if we can get the family exercising together, there'll be positive benefits for the kids as well. Not only do we improve exercise, do we improve fitness, health and mental health, but it also reduces the bad habits. It reduces TV, video games, smoking and alcohol consumption. Looking at the kids themselves, reduced obesity, improved attachment, social development and school performance. And I think there's one thing that we've seen from a number of studies, and certainly my support of veterans and their families, is that it helps family members to feel part of a treatment plan. So if they're supporting their veteran who's struggling, they can actually be providing treatment by getting out and exercising with them. I think I'll leave it there. There are perhaps a few other things that we can discuss, but I'm sure they'll come up with the questions along the way.
I'm sure they will. Thank you very much indeed, Sam. So the evidence is clearly in. We're not just guessing about this. We've got data.
Yeah, that's true.
Yeah. I was interested in your comment that some of the evidence suggests that those who are most unfit actually do particularly well. But would you advise someone, if we're talking to people who perhaps have not done exercise for a very long time, would you advise them to get some kind of medical check before they start going for a jog?
Yeah, Mark, I would. Popping in and seeing your doctor regularly for health checks is obviously very important of any treatment plan. But if you're someone that has, or a family that has really done no exercise, then just touching base with your doctor to make sure that you're fit and ready and you're not going to be at increased risk is important. And then there's different ways that you can go about doing that exercise. You know, firstly, get out and get active and do what you've been doing before in the past. You know, whether that's swimming or walking, hitting the gym. But maybe finding a trainer or a group session, or even through DVA and getting access to the exercise physiologists that the system can pay for, can be a really good way of building and tailoring an exercise program for you.
Good. That makes a lot of good sense. Thank you very much, Sam. It's time now to throw it open to your questions, and thank you very much to all of you who sent in questions already. And we've got a few coming in as well now as the webinar started, so please do send in your questions and comments as we go along. We've already answered, I think, some of these, and we'll do our very best to get to all of them, but please bear with us if we don't get to your particular question. The good news is that VVCS will prepare a spreadsheet with all of the questions and a brief answer to each. So if we don't get to answer your question today, then you can check that out when it comes out very shortly. But I would like to start our discussion with, well, what I think is perhaps one of the biggest problems, and that is how we, to use jargon, how we get compliance. How do we get people to exercise? How do we get people to translate those great intentions into exercise? And I wondered if we might start with you, Sam, and I'm just interested if you've got any ideas about what the common barriers are that stop people from getting into exercise.
Yeah, look, Mark, I think there's a little degree of cost, although heading out for a walk should really only be as expensive as the next pair of running shoes. I think motivation is probably the biggest one. You know, mental health issues, PTSD, depression, stress, you know, motivation drops off, and that's definitely part of it. So people really find it hard just to get started. And what I get a lot of my patients to do is to start with 15 minutes a day. And that might be just being active. That might be taking the kids down to the park. But at least heading around the block is your best start. And then building on that as you go. Ideally, we want to get up to about 45, 60 minutes a day, most days of the week. You're allowed to give yourself a day or two off, that's for sure. And the level of activity is important as well. Ideally, we want that to be strenuous. We want to get the heart rate up. We want to burn those stress hormones off. And that will not only improve mental health, but also lifts your fitness.
But I don't want to scare people off. Would it be reasonable to say that any exercise is better than no exercise? If you don't feel that you can get up to that very strenuous level, that even going for a walk is probably a good thing?
Oh, without a doubt. It's better than a kick in the head, definitely. Yeah. But it is about doing something. So I think that the take-home message about how much is get out there and do something. at least 15 minutes a day.
Yeah. Okay, good. So we've slightly drifted off the idea of how we can help people to stick to their good intentions. Have you got any ideas, Adrian, about what helped you? I mean, it must have been pretty difficult to motivate yourself at times to get up and train. What kind of things helped you to do it?
Yeah, Mark, look, I think goal setting was important for me. I'd always, your military career, if you're still serving or if you've left defence, is all about your next course or your next promotion. It's reevaluating if you have left and looking at what your goals are for the future. For me, I was given the opportunity of Invictus, so I then used that to goal set and train towards competing. And it was, the experience itself was phenomenal. But I think, you've just got to sort of re-establish yourself in your community, essentially. Going for a walk. We go for a walk with my family. Every weekend we go for several walks, actually, and then the kids always want to do more and more sport. So we go to the local sea pool, which, we're lucky enough to be in a part of the world where there's a local sea pool, but the kids, they want to be active. It was harder for me because I didn't, but I used my kids as the inspiration for that to drive me forward.
Yeah, absolutely. So that idea of involving, in this case, the family and motivating each other, I suppose, to keep it going is a great idea. And maybe, I guess, other groups, if you've got groups of friends or peers that you might be able to walk with or exercise with at the gym or cycle with, or that helps, I guess, doesn't it, having a group?
But I think ex-members tend to get a bit out of the habit as well. When we're in the system, we do a lot of physical training it's part of what we do, it's part of our day. And I think after discharge, people tend to get it out of the habit. And a lot of that is they want to leave the system behind. They don't want to have anything that may associate with that. And I fear that exercise may be one of those things that gets left behind. And so I really encourage people to, right from discharge, is to keep activity there. You don't need necessarily to be as fit as you were when you're in the system, but you need a degree of fitness, and so keeping that going.
And I think that's an important point, isn't it, that there's tendency to say, I'm never going to be able to get back to what I was, so I won't even bother. That's a very dangerous mindset to get into, isn't it?
Yeah, that's without a doubt. And life changes, life rolls on. I mean, I've come from elite sport. I've come from almost an OCD about exercising, where I've needed to exercise at that highest level and be 100% fit. But at the moment, with business and kids and other stuff going on, I just don't have time to be that fit. So I know for this year or so, all I can do is get out and do those 20 minutes or so. But give me 12 months down the track once life settles, and I'll be back out there again and able to exercise more. Yeah. So I think it's just recognising that as well.
So let me say that I would really encourage you at home to, if you're hearing any ideas that you think click for you and that might help for you, do jot them down so that you remember it and you can put it into action. So certainly we've talked a bit about how important it is to plan and perhaps set goals, maybe start small, build up, that kind of stuff. We've talked about exercising with family and friends as being important. Continuing this kind of theme, have either of you got any views on, we hear a lot about personal trainers now, and everybody seems to have their personal trainer, but that can get expensive. Do you think there are advantages? I'd perhaps start with you, Adrian. Any advantages to personal trainers?
Yeah, Mark, I think there's definite advantages. For myself, I've got recognised injuries as a result of my service, so I can exercise physiologist, which is wonderful. But it's also getting the right fit. And Sam touched on that a minute ago when he was talking about, in defence, the people that are administering the fitness aren't typically the people that I want to be, showing me fitness as a civilian now. So I wrongly chose a personal trainer in the early stages that was quite a lot like a military PTI, and it did put me off. So in re-evaluating, I now go to a local community exercise physiologist, and they do a lot of things. They've got GPs, psychologists, so it's all integrative health in the one spot. And it's a group of sort of middle-aged ladies. And to be honest, it's a really good fit for me. So they don't push me to my limits, but, you know, they challenge me, and then they set more goals, and they make it difficult.
Well, it's an important point, isn't it? And I guess, you know, if we talk about personal trainers, it doesn't have to be some high-level, very expensive person. Your local YMCA, your local community gym, or whatever might be able to provide some. Do you have any comments?
Yeah, look, I'd like to explain a little bit more about who exercise physiologists are. So they're university-trained trainers, basically, but their core way that they can help us is with rehabilitation. So they have more knowledge than your general PT or personal trainer, and they can incorporate both fitness with injury rehabilitation. So targeting a program that takes into consideration that your knee's buggered, or your back's terrible, or you only have one limb, or whatever it may be. And they will work together to build a base of fitness and help build strength and conditioning. They also have the right language and experience and knowledge to work with your physiotherapist that may be providing your targeted treatment to build that overall care. Now, how do we access them? And this is where DBA can help, or if you're not working through DBA, your GP can help. So DBA can, you know, with particular injuries, both physical and mental, your GP will be able to refer you off to an exercise physiologist to build that program. If you don't have DBA, then the GP, there are management plans that can assist with that as well.
Yeah, good. Okay, and just continuing this theme of what might help us, any tips and tricks kind of thing. Who was it? Jim from Adelaide has asked us about Fitbits in particular, and I would expand that to Fitbits and apps and things like that. Do you think that they're valuable? Do they have benefit?
Oh, look, they keep you honest.
Yeah.
They're not necessarily for everybody. They certainly help you monitor your sleep, monitor your activity levels, monitor your steps through the day. Are you getting enough? And when you're exercising, keep track of your heart rate. Are you getting that intensity up there? Does everybody need them? No. But it's definitely a way to add to that motivation and to keep you honest.
Yeah.
What do you reckon, mate?
Yeah, look, I agree. I used them when I was quite unwell, because I wanted to be able to monitor my sleep behaviour. And, you know, it turned out that I had really bad sleep hygiene, so it was effective for me during that time. I don't use it now, but yeah, I feel, you know, if you can see a need for it and you want to use it, then by all means.
It's different strokes for different blokes, isn't it? Really, it's whatever works for you, I guess. I must say that I favour the low-tech option of the chart on the fridge, you know, with the little star that says, I've done it. Which, but again, that's kind of constant feedback that I'm doing okay, I'm meeting my goals and so on. So,
if you don't think you're going to use one, I'd rather people went and spent that money on a new pair of running shoes, which will reduce their chance of injury.
good point. Very good advice. Very good advice. Now, we've had an interesting question from Jeff here, which I think raising an important point, and that is about the risk of, he calls it exercise dependency, but, you know, is there a risk that we actually become almost addicted to exercise? And we know of people who almost seem to go over the top in terms of exercising. Is it a risk, do you think?
Yes, to a degree. I think there are some people that do become quite obsessive about that exercise, and you know, is it feeding into their body image issues? But I think that it comes back to the rower example I gave. You know, for some people, exercise is a very important way to meditate. Literally, just take themselves away from their thoughts, give themselves a chance to relax. But also the feeding those right hormones, the endorphins, the dopamine, the serotonin in the brain, so it's providing that treatment. And if that level of exercise drops off, their treatment drops off.
Yeah. And I guess to state the obvious, if you're going to be addicted to anything, exercise is probably better than most other things.
Balanced with injury risk.
I was just going to say, yes, exactly. Yeah, quite. Okay. I'd like to talk a little bit about medications, if we could, because I guess a lot of people are on different medications. And I'd like to come to antidepressants and drugs for mental health in just a minute. But to kick us off, Sam, do we need to be concerned about any medications if people are on blood pressure meds or analgesics or any kind of meds? Do we need to be worried about that when we exercise?
Not usually, Mark. I I think it's probably more what's the underlying condition why you are on those medications. So perhaps if you're taking a lot or you're not sure, touching base with your GP and just checking first would be the right thing to do.
Yeah, quite. Moving on then to what we call psychotropic medication, but medication for mental health, and I'm thinking particularly here about the antidepressants that I guess, many people are on nowadays, particularly as a treatment for PTSD and treatment for depression. Have either of you got any comments? I wonder if you've got any comments, Adrian, about antidepressants and whether they may be helpful or harmful in terms of getting people to exercise?
Look, my own personal journey, I talk quite openly about this. So I was that depressed. My serotonin levels were so low that I had no motivation to. I did very little. I still managed to get up and go to work, but in terms of looking after my health, I wasn't doing anything. So they helped me get to a normal, normal level. I was able to, as soon as I started taking them and they sort of settled in, I actually felt motivation again. Like I wanted to go out and run. As I used to run a lot because of my injuries. I can't run anymore, but my serotonin increased. Probably not the best activity for me, to be honest, running, but that's what I wanted to do. So I feel everyone is unique, but there is definitely a place for medications if they're warranted.
And I guess it would be true to say, wouldn't it, Sam, that people respond differently to different medications, and that if they find they're on a medication that's making them flat and lacking in energy and so on, it might be worth having a chat to their doctor about whether or not there's another one that might suit them better. Would that be reasonable?
Definitely, Mark, definitely. I think, when we look at depression, anxiety, stress, PTSD, there's a lot of big overlapping bubbles of those conditions. And very central to them is not only is there low mood, but there's other effects, poor motivation, poor concentration, poor problem solving. And that's, the interaction of those is often why people aren't getting out there and enjoying themselves, seeing friends and family, or exercising. So when someone might be in the moderate or severe category and the basic treatments they're trying aren't working, then we want to look at medication. And as we've spoken about a lot today, exercise is a great adjunct. It's a great treatment for these issues. So, yes, the medications may be needed to improve mood, lift motivation, and along with that will hopefully be the motivation to exercise, which will provide greater benefit as well.
Yeah. OK, on a slightly related issue, there's been a number of people who have asked us questions about diet and the relationship between diet and exercise. And I'll kind of work through them. But the first question, this came from Jane, was to say, what about supplements? We see a lot about protein bars and protein supplements and other supplements and even, of course, to more dangerous stuff. Do you think they help, Adrian? I mean, your average person out there listening to us, do they need any kind of supplements, do you think?
Look, I suppose, again, it's everyone is an individual and everyone's journey of recovery and what they're going through is always going to be unique. For me, they provided, I suppose, extra nutrition that I probably wasn't getting from my diet. So I'd take supplements to help me be able to perform at, quite a high level of function for the sports that I was trying to compete in. But again, I think it needs to be balanced, and I wouldn't ever recommend to anyone to just go out and start buying things. I went through my GP, went and saw a nutritionist, and then I actually got referred eventually to a naturopath that was able to look at my whole lifestyle. So that was a little bit outside of the medical model, but it was something that for me was useful. I like that,
and certainly the idea of not just seeing something on the shelf that's guaranteed to improve your fitness or something, but actually getting expert advice. I agree. And would it be reasonable to say that just a good healthy diet is actually a good starting point, really, to giving you the energy?
In Australia, if you're eating a good healthy diet with predominantly fresh foods, only eating a small amount of processed food, that you're drawing from fruits and veggies and meats and cereals and carbs, then you don't need to supplement. We don't need a multivitamin tablet. That healthy, balanced diet will give you enough of your micronutrients, your minerals and your vitamins. Yes, though, there are some people that are deficient in B12 occasionally or folate or iron, but we've got to remember that they're a small percentage. So firstly, healthy balanced diet is generally all you need. Then when we look at the exercise science behind supplements, we could talk about this for hours. Protein shakes are really just a convenient way to give you protein, often a fast way to give you protein, especially for people that are on the run or who find it hard to find it hard to eat after exercise. So drinking protein can be easier. As far as total protein goes, we often don't need to add that the protein powders to what we're already eating in our diets. Supplement-wise, you got your steroids; they're illegal. Don't touch them. They'll actually make your mental health worse too. Peptides, look, that one's an evolving science at the moment. There's some evidence that they are helpful, and there's some evidence that they're safe, but we also just don't know enough about them. So I'm still asking people to keep away from peptides and the borderline legalities of them as well.
Okay.
Creatine and a few others, there is good evidence for creatine, but you've probably got to be an elite athlete to get the benefit out of it, but it can help with recovery. So creatine's not a bad one.
But I was just going to say, I guess, we're not talking elite athletes here. We're talking your average bloke or woman going for a run. We probably don't need these supplements.
We've trained with a lot of blokes that think they're elite athletes, haven't we, Adrian?
Sure, it's true. Can I just ask, and just a very quick response, really, because I know nothing about them, but Steve has asked us about fat burners. I don't know what they are. Are they helpful? Are they dangerous? Are they addictive?
Do you want the short answer?
The short answer.
Waste of time. Don't worry about them.
Good. I think that's probably all we need on that one, actually. That's lovely. And another, just while we're talking about food, another one from Marie asking, should I exercise on a full or an empty stomach? Does it make any difference?
Oh, I think it's a comfort thing. What do you reckon?
Yeah, look, if I don't eat before I train, so I train really early because I work full time, then I don't feel very good during my training. So I always, I'll have a banana, and make sure I get some fluid into me before I train. But again, I think it's each to their own. If it's good for you and works, then stick to it.
Yeah.
Yeah, I think if you haven't had something to eat or drink for a long time, you do want to get a little bit of energy, protein and fluids into you. So if you're getting up early in the morning, a little bit, probably wouldn't do the full stomach though.
Yeah. Sure. OK. Bill from Sydney is asking what I think is a very important question for perhaps many people listening. And I wonder if it was for you as well, Adrian. And that is about chronic pain. That chronic pain is stopping him from exercising. And he says it's feeding into my depression. Obviously, managing chronic pain is a whole other issue we could do a whole webinar on. But was pain an issue for you, or did you have any ideas about how people might manage that? Yeah,
look, Mark, again, this is something that you have to work out the best way forward for yourself. For me, I was medicated for many, many years, and I was on some incredibly strong painkillers. Right now I've got some stuff going on with my hips, so I've got to have another hip replacement. I had a full right hip replacement a couple of years ago, and it's been put in at the wrong angle, so I have to go through that again. So I'm in quite a lot of pain now, so I'm back on painkillers. But I got to a point in my recovery where the pain was a constant, so it was my perception of the pain. So, if you go out and injure yourself, you've obviously got that acute pain, you're like, ouch, that really hurts. But for me, I'd lived with that pain for many years, so it wasn't that bad for me. I'd got to that chronic level, but, I was still living and breathing and functioning. And yes, it hurt, but it was just how I was perceiving the pain. So that's been an incredibly long journey for me now. And now I'm at that point again where there's something wrong, there's something mechanically wrong, so I need surgery, so they've put me back on painkillers. So again, you've got to just find out what's right for you, I think. You need to work with your health professionals, your mental health professionals if you've got them, your GPs and your supports, and find out what's right for you.
That is a key message, isn't it? Working with your treating practitioners. Yeah.
Yeah, I was going to reiterate that when it comes to pain, that implies that there is some sort of injury there or anatomical problem that needs fixing, and that's where that team-based approach comes in. GP, physio, exercise physiologist, building the right program for you that looks at rehabilitation, strength conditioning for the injury, and then overall fitness. And so pop in and see that team and get them working together.
Okay, we do have a few more questions, but we're kind of running out of time, really, and I'm not sure whether I should open up another can of worms. I guess just perhaps let me ask the question about beyond exercise, the benefits of improving our physical health generally, I suppose, and I'm thinking things like eating right, eating a good diet, reducing drugs and alcohol and smoking and all these kinds of things, getting good sleep, are all going to contribute, presumably, to good mental health as well? All going to feed in, do you think?
Yes.
Without a doubt. If only it was as simple as that, which of course it's not. And that's what we're talking about is addressing everything and bringing exercise in as another way for people to improve all of those other things.
So as part of a broader healthy lifestyle.
Yeah, that's right. You know, I spoke about the very positive benefits of exercise and related to the hormones in the brain and then general health, heart and weight. But there's also the pure meditation side of things, getting away from that stress, that is of benefit as well.
Good. Yeah, look, I think you nailed it. What I used to do, I used to identify as my injuries. I was Adrian Talbot with osteoarthritis and a psychological, injury. When I stepped away and then looked at whole of life, in factoring in everything and then finding out what was right for my journey. I had a lot of people telling me that this was right and that was right, which was all fantastic advice, but it was putting the puzzle together for myself and then figuring out what was right for me.
I think that's a key point, isn't it? So once you've made the decision that you want to do something about this, there's a lot of people out there to help you. It's really just making that first decision that it's something that you want to do and you're committed to doing.
And improving your fitness improves your resilience as well. It improves with your function through the day. Mums will agree, as they get fitter, they're able to look after their kids better, less tired at the end of the day. So, another reason to get out there.
Yeah. It's got endless benefits, hasn't it? Yeah. Okay, look, unfortunately, time has run out. It always seems to go remarkably quickly on these webinars. But before we wrap up, I would like to ask our panellists whether they have any take-home messages, any final points that they'd like to leave the audience with. Perhaps I could start with you, Adrian. Any final comments that you'd like to make?
Yeah, thanks, Mark. If you're out there and you're struggling, there's, as we've spoken about today, there's people that you can reconnect with. Get in touch with, come through VVCS. There's other community organisations, and please reconnect, because I know that it can be difficult and it can be a struggle, but there's other people that have gone through it. And so, use their personal journeys to draw inspiration for yourself.
Good advice, Adrian. Good advice. You don't have to do this on your own, basically. I think that's really very important. Sam, any final take-home comments?
Yes, I want to urge people to make a decision today. Make a decision to change, and with your family together, to increase the amount of exercise you're doing. If you're doing nothing, then I just want you to get out there and just do something. If you're already doing it occasionally, then increase the time or the number of days a week that you're exercising for. But please, make a decision today to make a change.
That's often the hardest part, isn't it? Making that decision that you're going to do something about it. Okay. Thank you very much to you both. We have a slide that has a number of resources. There's a lot of resources available, and I would encourage you to follow up those resources. That list and other resources will be available when the video and the supporting resources go online. I would particularly like to give a mention to the At Ease website, which is not actually on there, but the At Ease website run by DVA has some great stuff for veterans and serving personnel and their families, as well as clinicians. So you might want to draw it to the attention of your GP or treating practitioner. And of course, you need to remember that support is always available there for serving members, for veterans and for their families. I'm aware of the fact that it's possible that some of the stuff we've spoken about today may have raised a few issues for you. Don't forget that VVCS is there to support you. It's there to support your family, so please don't hesitate to use it. I'd like to remind you all, if I could, to complete the online evaluation, which will come up before you log out of the webinar. It really is important in helping us to better suit your needs. And we will be, as I said, posting a link to the video from this webinar very, very shortly. So finally, I would like to thank all of you for participating in this webinar. I've been really impressed by your engagement and your interest in the topic. It's been really good. I'd like to thank VVCS very much for organising it. And of course, I'd like to warmly thank my two panellists, Adrian and Sam, for your excellent input today. Thank you very much. Thank you to everybody again for participating. Goodbye and enjoy the rest of your day.